Hi, I am 43 years old. I live in Norway. I have a genetic disorder called familial malignant melanoma, and this is my story. So my grandmother had cancer in her tongue and in her salivary glands when she was young, and that was the first memory of cancer in my family I have. Later on, my father got lung cancer and died of it in 1997. My father was a smoker, and he didn't get tested for this gene, but my aunt, which also had lung cancer, she tested positive for this gene, and she also had lung cancer. When we received the news about that we could have a genetic disease in our family, at first we were like, okay, that makes sense because we have a lot of cancers in our family, and we didn't think so much about it. But in 2019, I got a phone from my cousin who also got tested for this gene disorder, and she tested positive, and she recommended me to do this test. So I did it in 2019, and when I got positive, I was like in shock because the other three sisters and brothers was negative. So I felt a little bit like, why me? But at the same time, I think I am the person that managed to cope with this situation better than my sisters and brothers, actually. So, but it made you think about the future and about your kids, and will I get cancer, and when do I get cancer? For 3 years ago, I had my first malignant melanoma in situ. It's not so big, but I also have 4 times got appointment for extended removal because the pathologist didn't find the moles, or the edges of the moles were not so good, so they wanted to take an extended biopsy just to check, but they were all okay. So yeah, that's my history for the moles. I always check my body, like when I clean myself, I just check and see if I get any moles that are blacker or worse. So I can just call. They always say to me that just call if you see anything changes. So I go once a year now for checkups in the hospitals, where they use cameras to enlarge every moles on my body, and they take photos of it and compare it to older photos. And if they see any changes, bad signs in my moles, or I see any changes before I go to the hospital, they just take away the moles and send it in for checks. So since I also have a higher risk of other cancers like pancreatic cancer or leukemia, and also smoke-related cancers, I am now going to get an MR for checking my pancreatic to see if it's okay or not, and that's a study which are new here in Bergen, and I am lucky to get a part of that study. Once a year I go to the gynecologists, and I also now are having an appointment to an eye doctor because I also can get moles on my eyes. So I'm very happy I took this test because I get very close follow-ups from many parts. And I know for sure that if I get cancer, it will be detected in a very early phase, and I probably won't die of it, like many other people can if they don't get tested and they don't have any specific genes to get tested. The only concern I have is that I feel bad for my kids if they have inherited it.